Thousands of people every week seek help from doctors and nurses at the Khayelitsha Hospital in Cape Town. And while many complain about public health facilities, few take the time to listen to the challenges. Doctors and nurses at Khayelitsha Hospital say they are struggling with limited resources to help the township's residents.
We are helping now 122, and at most we can accommodate about 50. It is difficult, right? Patients do have a prolonged time to wait for ward beds, but we do try and facilitate as much as what we can. Well, the staff are very motivated, and the staff do try and do what they can. It is overwhelming on occasion, but everybody's trying and striving to do what they can. The focus needs to be on the prevention of emergencies and to have a social intervention. The focus on the social crises within Khayelitsha. And those social crises involve alcohol, drugs, crime. And those three are our biggest, I think it's the biggest things that she can impact.
Well, we don't really have supplies. There are many challenges. We don't have space. We work with sometimes very sick patients. And I understand that, because they are that sick, they tend to be less patient sometimes, and we tend to expect them to be able to bear with us, and they don't always understand. So our challenges range from having less than most people expect that we should have. We unfortunately have not enough doctors to deal with the large amount of patients and the problems that we deal with. Like today, it's not that busy, but normally on a weekend and at night we see lots of trauma, and we go from one patient to the next, and that's often difficult. Not only is it sometimes traumatizing to the more junior staff, and they're often expected to just move on to the next case, but many of the other patients get neglected in the meantime, and we often have to push patients off beds to deal with the more dying patient. But we do try our best. We really love working here, so we do our very best to see that everybody is seen to, and that we give the best care that we can to our patients. Well, we need more staff. We need, I don't know, if our budget allows for it, we need more supplies, we need more blood tubes, we need more drips, we need everything. I think, well, there are many things, and for me to only say, there are often times that we try and make do with what we can, and often that's okay, but sometimes, that's not enough, and that can be to the detriment of the patient. So I think it all boils down to finances, basically. So we can't physically open, so this is like one of the sets in here. It's often that we don't have everything in here, so we don't always have a scissor in here. We perhaps have some of the supplies that are supposed to be in here. But one goes for a patient, and once this is up, it needs to go to a certain autoclave, and it needs to be sterilized, and it takes time. So there's only a certain amount for the entire hospital and EC in a whole. These are resus drawers. Usually resus is basically stocked very well, because if we have a patient coming, a dead patient, we need to make sure that we have everything, and it takes the least amount of time. Our resus area is generally not the problem area, it's generally the other areas. So everybody comes here basically to just run quickly and grab things quickly. But yeah, so this is basically our mask. As you can see, this is a mask that we use for patients, and almost every patient gets this mask. There are more than one mask, there's about 3, but we don't have enough, basically. We also do CPAP, you can see, so we also CPAP with this mask. So we try and do, and we put elastoplast to stick it onto a patient's face in order to accommodate for not having proper CVP mask. And that would really help us if we actually had the proper CVP mask.
The Western Cape Health Minister, Nomafrench Mbombo, says her department has a plan to build more health facilities to meet the needs of locals.
We have already drawn up a hospital bed plan for up to 2030, because we've got a 2030 health plan. So we have drawn up the hospital bed plan, which we will do it into phases. And then within there, because I don't want to preempt now, so within there, you'll find that there will be additional more hospitals that will need to be built, and also there might be a combination of some where you find that you ask yourself, is there need to have a small clinic, maybe 3 or 4 small clinics in a certain area, instead of having, let's say, a community health center.
Khayelitsha Hospital nurses who live in the township say they are also not safe as residents threaten them. They say residents sometimes even wait for them outside the hospital.
We are facing a big challenges in this hospital because this hospital is too small. The communities are too big and they are very sick. And more than that, they are complaining. And they are shouting, they need help, they need everything. Whereas we are doing our best. Even our doctors, they're doing our best, they are trying to help the communities. And we're always explaining to them, this hospital, we've got so much amount of the bed in the ward here in trauma. Luckily, we have a big trauma in resource here. But we are trying to everyone to get help. Especially on the mountain, we are receiving maybe, especially in research, you see in research we've got only 4 beds. Maybe sometimes we find out we've got 30 patients in research, they are stabbed. The lot of things here, it's a crime. They are stabbing each other, crime, they are gunshotting each other. So we can't help them at one time, at the same time. We are trying to help them until they change over. They get angry. Although we're trying to explain to them we are short of staff, we are short of the doctors, but they don't want to listen. The thing is, they want to come here to get help. I mean, how can I put this? If they come here, they want to come and open a folder and get help at the same time. You only find out we are using this mall. I'm staying around here in this location. For me, I'm talking about me, I'm staying around here. Sometimes they are shouting and then intimidating us, you know, and then you get scared after that. Yes, they come drunk, they always come to fight with us. They always come to fight with us, although we're trying our best.
You know, when the parents came in this ward, they came with attitudes. When we are telling them about the policy of the hospital, they become rude to us. We've got an incident that I think it was last year when the father came in here, and then the policy of the hospital, they're supposed to start from the clinics, and they don't want to go to the clinics. They come straight to the hospital. And when we are trying to explain to them, I mean, they don't want to listen to us. They become rude, wanted to hit us. And we do report them to the securities, but they even overpower our securities. They do abuse us, verbally, emotionally, even the others, they wanted to hit us. And we are not safe at all in this place. Not safe at all. We are not safe even if we are going home, because you know, the others, they even swear at us. They say they are going to wait for us outside the gates, because we also stay with them in the community. So they always just tell us, even if you can be, I mean, you are a nurse, but outside, I'm gonna catch you. So we are not safe. There's not even a transport to take us to the nearest places. Like even the hospital transport can take us just to the next to the taxis. They don't offer us that, you know, just to be safe to those people that are so rude to us. Shortage of staff. That's the other thing. Shortage of staff. For instance, in this ward there are 10 males, 10 females. And there's only like 3 staff in each ward, which is the professional nurse, enrolled nurse, and assistant nurse. 3-3. And the ratio is not like You can't nurse 10 patients when you are only 3. And the money, the government, the Department of Health is not like paying us that's a living wage. They can't even give us with living wage.
The Western Cape Health Minister Nomafrench Mbombo says her department is working to ensure the safety of staff at public health facilities.
First of all, it needs a whole of society. We have to be all of us together. The government cannot do it alone, which is, in most instances, you'll find that the criminals are coming from the communities. They are not outside that community, outside that area where the hospital health facility serves. So it means they are part of the community. So it means that we need the support from the community in terms of the crime prevention. And in addition to that, you can bring the security people, but we know that when it comes to the gunfight and whatever, all of those, it goes beyond. But the question is now, Minister, you're in government, so for now, what are you doing, especially for your staff? We have seen recently of the attacks of the EMS for the emergencies, the paramedics, even robbed at gunpoint with the ambulances where they were throwing stones. For example, initially we used to say if now there's an element of that criminal activities, that the ambulance will have to wait for the police to escort them. But now the police will tell you, actually we don't have staff to escort. So one might probably resort to say that, okay, ambulance, don't go. But the question is, if there's a health facility there and there are staff members already in that crime scene, so how can you prevent now the others to say they mustn't go? But what we are doing now, as part of our goals for the next 5 years, we have a working group, and it's a priority to provide safety in our facilities, working with the Department of Safety and also within the metro.